So I'd like to begin by acknowledging the traditional owners of the land, the Kulin Nation, and pay my respects to their elders past and present and the elders from other communities who may be also here today. So thank you for inviting me, and it is a great pleasure to be here. And I was in fact part of the Q&A here on this very stage last year, which was a really enjoyable experience. So I'm talking on the future of primary health care nursing in Australia and internationally. But let me just begin by saying what a bright future I think that will be. So my talk today on the future of primary health care nursing will fall under the broader headings of technological innovations and advancements, the shift in care settings from the acute to the primary care sector, and nurses and midwives utilising their extensive experience and knowledge to work at an extended scope of practice in all settings. So I'll start today by discussing the fast-paced development of information technology, which is such an important tool for the future in general, but also very applicable to healthcare. But it is essential for us as nurses and midwives to be visionary and to be leaders in strategic thinking and communication about the development and application of technology. And I do acknowledge Andrew Lamming's words around being visionary and taking control of the future. Technology, and particularly its use in healthcare, does not necessarily reside in the world of science fiction. Relatively simple initiatives are often highly effective. So one example is the use of video game consoles. Video, of course, sounds so old-fashioned now, to support exercise programs in care homes. Isolated elders can be encouraged to participate in exercise and socialise through the use of such platforms. Now I know, and I'm sure that many of you, most all of you, have heard of the personally controlled electronic health care record, which is widely known by the acronym PCEHR, and I hope that you've all registered for one. Of course, it is an initiative of the Commonwealth Government, and so we do have weekly updates as to how many people have registered. So I kind of look forward to a surge after this conference. So for those of you who are less familiar with this development, an e-health record is an electronic summary of consumer health records that enables authorised healthcare providers access online whenever needed. So until now, of course, medical records have been stored in different locations by different healthcare professionals. But with an e-health record, consumers can view an online summary of their information wherever they have access to the internet. For practice nurses and midwives, the PCEHR will support the quality of care you deliver by giving you more time with patients and access to information you might otherwise be unaware of, which will enable you to make the best decisions possible about healthcare needs. As practice nurses and midwives, you will also have the ability to contribute to the PCEHR by uploading health summaries to the e-health record as part of a consultation. And I know that's just a sentence in my speech, and you might think it might just have sort of, well, been in the ether, so to speak, but let me tell you, that's a really, really important statement, that nurses are able to upload health summaries in the e-health record. Really important for our practice and particularly into the future. And it was not, it was certainly an initiative that was fought very hardly, it was fought over, put it that way. So having an e-health record can make giving the right treatment faster, safer and easier. Faster because doctors, nurses and midwives and other health professionals will not have to spend time searching for past treatment information. Safer because authorised healthcare professionals can view patients' important health information, including any allergies and vaccinations, as well as the treatment received. And of course easier because consumers will not have to remember the results of tests or all the medications prescribed. And unfortunately, I recently have become a consumer of healthcare, and it is quite difficult for me to keep a kind of a handle on all the different things I should be doing and communicate, making sure that the specialist and the GP are communicating and filling in gaps for them. And, you know, for me, that's relatively easy because I'm a healthcare professional, but not that easy for patients at large or the community at large. My colleague, Linda Powell, will be presenting later today on the personally controlled electronic health record, and we are adding new functionality soon, and she'll provide further details on these developments, specifically around child health. And as you probably heard in the introduction, I have a background in maternal and child health nursing, building on what Andrew said about how important the years of 0 to 5 are. I absolutely heartily endorse that concept. But I'd also like to mention telehealth in Australia, another momentous and an innovative development for the future of primary care nursing in Australia and primary health care, and one which extends the reach of primary care to rural and remote areas. The Australian Government has introduced a number of measures to foster the adoption of telehealth in Australia, including the provision of Medicare rebates for telehealth specialist services. And these measures are part of the broader commitment to increase access to services in rural and remote areas. And later this morning I shall be launching, yes, you haven't heard the last of me yet, the telehealth standards for registered nurses and registered midwives, as well as the guidelines for telehealth online video consultation funded through Medicare. These projects were funded by the Australian Government to assist in the introduction and uptake of Medicare rebates available for telehealth consultations, as well as to ensure that existing health professionals, as well as those newly entering the workforce, have training and support available in the use of online technologies to deliver health services. I think these new developments in Australia are a testament to the fact that society is very much changing, but nursing as a profession is adapting well to such fast-paced developments by incorporating these innovations into mainstream care. So if I can come back to what I see in the future for nursing more broadly in Australia and in many other developed countries, the emphasis has historically always been on the acute care setting. It comes as no shock to you. However, it's a well-known fact that the provision of healthcare services in Australia and across the globe cannot continue to be delivered by the same methods as we have seen in the past. So that brings me to my second theme today, the need for the focus in healthcare to shift from the acute care setting, which is very much illness-focused care, as it should be, to the primary healthcare sector, which provides more preventative-based, holistic care. And this shift needs to happen for a number of reasons. The first reason is one of Health Workforce Australia's key finding in its Health Workforce document 2025, Doctors, Nurses and Midwives report, that without nationally coordinated reform, Australia is likely to experience a significant shortage of nurses, which includes both registered nurses and enrolled nurses. And you heard, and my colleague Karen Cook will be talking about this later today, and you also heard Julianne Badenoch make mention of this earlier on. The projected shortfall is anticipated to be just over 20,000 nurses by 2016, culminating in a shortfall of about 109,000 nurses in 2025. These figures will be rerun, but that's the current state of play. The second reason is the rise in healthcare costs. According to the Australian Institute of Health and Welfare, every year Australia spends more on its health, even allowing for after inflation. As a proportion of all spending on goods and services, health spending has increased from 7.9% to 9.4% over the past decade, and like other OECD countries has increased at a faster rate than spending on all other goods and services. The third reason why we cannot continue to deliver health care in the same way relates to the increasing demand for health care services. In developed countries, this may be attributed to the ageing population, as well as the prevalence of non-communicable illness and the rise of chronic disease within the community. Chronic disease is responsible for 60% of deaths worldwide. Unfortunately, here in Australia, that percentage is even higher. Recent World Health Organisation statistics show that non-communicable diseases are responsible for 90% of all deaths in Australia. And in 2011, it was estimated that chronic conditions accounted for 36% of general practice activity. You just have to sit in a general practice waiting room, and I'm sure work in a general practice, to understand that. I think that the byproduct of these influences is the gradual shift away from illness-focused care in the acute setting to preventative care in the primary or community setting. And it is, I believe, the future focus of healthcare in Australia. Such a shift in healthcare settings also brings with it the need for expanded scopes of practice for nurses and midwives. Internationally speaking, in the UK, nurses and midwives have moved to more advanced roles, becoming the first-line care providers and leading the management of patients with stable chronic conditions such as asthma, diabetes and cardiovascular disease. In South Africa, nurses and midwives work as clinic managers and practitioners in township clinics that are visited by 200 to 300 patients daily. Nurses and midwives take histories and perform physical examinations, and if there's no medical practitioner available, it's nurses and midwives who provide comprehensive care, including the prescription of medications. I'll talk about that a bit in a minute. On scheduled days, nurses and midwives travel in specially equipped vans to take health care to the people, thus increasing access to their populations. In Canada, it has been demonstrated that when nurses and midwives use their full range of competencies and practice in expanded roles, more patients can receive the care that they need. When nurses and midwives are directly involved in the care of people with chronic health problems, these individuals develop a greater capacity to manage their disease, resulting in reduced hospital admissions and the lower likelihood of unnecessary readmissions. In Sweden, nurses and midwives are increasing access to medicines through prescribing rights. District nurses and midwives with additional training have prescriptive authority. And there is a list of over 230 brands of medications that qualified community nurses and midwives can prescribe for 60 conditions. Similarly, here in Australia, another innovative measure currently on our horizon is known as the Health Professionals Prescribing Pathway Project, which aims to develop a nationally consistent approach to prescribing by health professionals other than medical practitioners. This project is aimed at supporting safe practice, quality use of medicines and effective healthcare services. This project will increase the uptake of extended scopes or new or redesigned roles and increase the capacity of Australia's health workforce. It's a very positive step for us, and I hope it's just the beginning to see access by nurses and midwives to prescribing across the board. And we will not be the first country to do that. Health Workforce Australia also has another program called the Extended Scopes of Practice Project, in which there are two nursing projects, one of which is the Nursing and Emergency Department Initiative, which focuses on boosting retention and productivity of nurses in response to emergency medical workforce shortages, and particularly the increasing number of presentations to emergency departments and the rise in the number of patients with chronic health conditions. The second project is the Advanced Practice in Endoscopy Nursing Initiative, which of course is a bit controversial, that this aims to implement an innovative model of extended scope of practice for nurse endoscopists. This sub-project will ultimately enhance the capacity and capability of the workforce to cope with an increased demand for procedures. Of course, we know we have the National Bowel Screening Program, which is picking up bowel cancer at an earlier earlier in its gestation, and so having increasing access for endoscopy procedures is particularly important. So these are local and global examples, but they provide strong evidence through the adaptive utilisation of nurses and midwives' skills and experiences. And by working at an expanded scope of practice, nurses and midwives possess the means to address today's complex healthcare challenges, thereby aiming to achieve universal access to essential, cost-effective healthcare. So in conclusion, I'd like to summarise my hopes and visions for the future of nursing more generally, and how we as nurses and midwives can work together to achieve ultimate access of universal quality healthcare. As I said a moment ago, I believe that in the future we will see the continuation of expanded roles for nurses and midwives, particularly in relation to health promotion and preventative care, and in the management of chronic disease. Such advanced nursing practice will offer the workforce greater professional opportunities and continued development in new and expanded roles. So I think the future, it's our future, is the way I see it. We are just coming into our own, in my view, but I could go on about that, but I won't because I don't have time. I hope that the presence of nurse-led clinics will grow and become the backbone of primary health care in the broader community, firmly focused on patients, families and carers. I also see nurses and midwives as crucial to improving healthcare for disadvantaged groups and rural and remote communities. And of course the development of the PCEHR and telehealth will assist in that area. I do think that university-based education for nursing will continue to provide the foundations for the professions, and research will continue to underpin evidence-based best practice. And as Andrew said earlier, evidence is everything in today's world where we have pressure on budgets continuing to grow. I also firmly believe that nurses and midwives will work collaboratively in primary care to ensure that patients are provided with the most appropriate, effective and efficient care possible. As Kofi Annan once said, more than ever before in human history, we share a common destiny. We can master it only if we can face it together. So lastly, I'd like to say, as well as my role as the Commonwealth's Chief Nurse and Midwifery Officer, as Stuart said at the beginning, I'm also the current President of the International Council of Nurses. I have 3 weeks to run in that position. So we will be having the Congress in Melbourne in a couple of weeks' time, and this Congress is a global platform for the dissemination of a wealth of nursing knowledge and leadership across different specialties, cultures and countries. So I hope I'll see many of you in Melbourne shortly. Thank you very much.